Hello, everybody. Welcome to Author Spotlight for the month of July. I'm Dr. Patty Pellikka, Editor-in-Chief of Journal of the American Society of Echocardiography. Today, I'm joined by Dr. Jeremy Slivnick, who is the lead author of an interesting paper, Echocardiographic Detection of Regional Wall Motion Abnormalities using Artificial Intelligence compared to human readers. Welcome, Jeremy.
Hi, Dr. Pellikka. Thank you very much for the kind invitation to join you today.
Tell us about yourself.
Yeah, so I'm an advanced cardiac imager at the University of Chicago. I completed my imaging training there prior to joining the faculty. My main clinical practice focuses on echocardiography, cardiac CT, and cardiac MRI, in addition to time spent in clinic, as well as time spent on the inpatient teaching services. My research is largely focused on applications of cardiac imaging in the evaluation of patients with myocardial diseases and cardiomyopathies.
Well, I loved your paper. You really looked at a large group of patients and looked at apical images to detect regional wall motion abnormalities in 7 territories, and this was a collaboration with Philips. Tell us what inspired you to do this project.
Yeah, thank you. So, I think our readers here at the University of Chicago have long since noticed that there's been a high level of inter-observer variability in the assessment of regional wall motion abnormalities. Somewhat not surprising, since the evaluation is very subjective, highly experience dependent, and prone to differences based on sort of people's level of experience. This has also been shown in several previous studies as well. AI has really kind of made a major influx into the field of echocardiography, and one of the main advantages of it is the ability to rapidly and automatically assess clinical questions with a very low degree of inter-observer variability and high reproducibility. So based on that, we thought that this would be a good application for AI towards the evaluation of regional wall motion with echocardiography.
Definitely. What did you find?
Yeah, so essentially what we did for our study was we looked at, we trained an AI algorithm, a deep learning algorithm using raw images, using a large number of echo DICOMs and the clinical reports from echo readers as sort of the ground truth for model training. We ultimately used this to train and validate a deep learning model to predict the presence of regional wall motion abnormalities. We then evaluated this against expert and novice readers in order to compare the model's accuracy. And ultimately, we found that the deep learning model performed comparably to expert readers in most regional wall segments and outperformed 2 of the 3 novice readers that were assessed.
Were you surprised by those findings?
I don't think so. I think this was sort of what we were hoping for, obviously. And I think it was good to see that the model was able to approximate that of the expert readers. That part is somewhat not surprising, since it was trained with expert readers sort of as the ground truth. But we were glad to see that it performed similarly to the experts that were used in the reader study. We were glad to see that it outperformed a majority of novice readers as well. So I think ultimately it sort of substantiated the aims.
Is this something that you're about to roll out in your clinical practice?
Yeah, I think certainly our goal in the future would be to try to apply this model into clinical practice. I mean, I think as with yourself, we have a very busy clinical echocardiography lab, and I think even amongst expert readers, having a tool that could automate the detection of regional wall motion abnormalities could help to improve the efficiency even of expert readers. I think there's still some steps that need to be done moving forward to sort of get this to prime time, but I think that's certainly something that we're hoping to do in the future.
It's certainly an important endeavor. I think this really will improve standardization and reduce variability for interpretation of regional wall motion abnormalities, an important subject. Any next steps that you'd like to tell us about?
Yeah, absolutely. So the model was largely trained using apical non-contrast images, or exclusively trained using those. And so I think, refining the model to include parasternal views And obviously, to include contrast-enhanced images could potentially further improve the accuracy of the model. And as you know, in clinical practice, we're commonly using contrast, and we have the parasternal views as well that we integrate into our regional wall motion assessment. So I think that would be a next step in order to really get the most efficacy out of the model. And then I think, this was a collaboration, as you said, with Philips, and it was done on a single vendor training. And I think it'll be important for this to be generalizable, for this to be, for the model to be tested utilizing other ultrasound vendors.
Thank you very much, Dr. Slivnick, for visiting with me and for publishing this great paper in JASE. I'd like to encourage our readers to take a look at it, and also the excellent accompanying editorial by Drs. Casey Johnson and Paul Leeson.
Thank you very much, Dr. Pellikka. It was a pleasure to join you today, and thank you to the Journal of the American Society of Echo for recognizing our paper.